Okay, so last but not least, chapter 21, which is something that most of you guys may be familiar with. It covers a lot of anti-inflammatory drugs as well as musculoskeletal relaxers. So before we go any further, just in case you ever see something running around in the background, this is it. She, actually, it probably would have been good to cover under chapter 12. She recently had an allergic reaction where she had swelling and some hives going on. So skin medications, we gave her oral Benadryl and oral prednisone, a corticosteroid. And she's cleared right up, she's all better, but just an idea of what they might do if it were a dog. There are some human medications that we can use in puppies, and they do just fine on them, and just usually a lower dose for smaller little animals. So, skeletal muscle relaxants. Some of you guys may have heard some of the more common ones like Flexeril or Scalaxin, and those basically just relax the muscles if someone's had a muscle injury or if they're in chronic pain because of a tightened muscle. So, if we look to the first page, I don't think I even wrote, so this will be completely out of the book. So, ruptured discs, they go over injuries, backache, neck strain. Sometimes you can get it when you're sitting at a computer too long or if you're stressed out. There's a couple different options that can treat that. Some of them involve physical therapy, some of them involve heat or cold therapy, and some of them involve analgesics or NSAIDs or skeletal muscle relaxants. So they're usually given on a short-term basis, and I think every single one of them are prescription only, so you do have to see a physician before you can get any of these. They don't, it decreases the pain as well as relaxes the muscle, and that will help decrease the pain as well. Side effects can usually include fatigue, sedation, kind of feeling tired. You guys might also be familiar with benzodiazepines. Those, in addition to the ones I've already listed, such as Scalaxin and Flexeril, are used for muscle relaxants as well as other things that are covered outside of this chapter. So again, drowsiness, dizziness, dry mouth, weakness, headache. There's a whole list of side effects that can happen with these, but the most common one is definitely drowsiness. Anytime someone is sensitive to any of the medications, we recommend not using them. Pregnancy or lactation, also, again, not using them. And there's some other things listed here, and some of them do have to do with the side effects of the medication as far as precautions go. If someone has a cardiac or lung disorder, we try not to use them because it can sort of cause that decreased respiratory response, so we want to be careful with those patients. In addition, older adults, it can have more of that sedating effect on them and sort of expose them to falls or respiratory depression. So again, we are very careful. We either lower the dose or try to avoid these medications. Interactions, which can cause an increased effect of the medication. Alcohol, pain medications, because both of them can be sedating. Some psych meds, as well as antihistamines. And that all has to do with, again, over-sedating a patient. So if a medication causes drowsiness, like a pain medication, we might want to be careful what kind of muscle relaxants we're introducing in, because we don't want to make the patient too drowsy. Neuromuscular blocking agents. These are a source of error in hospitals constantly, because what happens with neuromuscular blocking agents is exactly what it sounds like. We usually use them to paralyze a patient before we intubate them. So we are shutting down their muscle response, and that includes everything from breathing, the ability to breathe, the ability to move. So imagine you are a patient and somebody has given you a neuromuscular blocking agent. You now depend on them to basically breathe, the actual function of breathing. In addition, you're stuck there, you can't move anything. So once we give these medications, they're pretty much non-reversible. So if it is given in error or given without the ventilation equipment being introduced in, you can actually quickly end a patient's life. So we are very careful with these agents. Some of them you might have heard, cisatracurium or Nimbex, rocuronium or Zemuron are one of the more common ones used. In our hospital, we put big pink stickers on them to let the nurse know that it is a neuromuscular blocking agent. We try to make them as safe as possible, kind of screaming out, hey, look at what you're giving before you give it, because anytime this medication is involved in an error, almost always leads to death. not to be morbid, but we just want to kind of make you aware, just like insulin or pain medications, this is even as serious, if not more serious. Usually we only, we try to only keep them stocked in places like an ICU, which is a higher level of care, or a place where anesthesiologists are, so that the patient is being monitored and treated appropriately by a person who's experienced with using those medications. Finally, what everyone is probably familiar with, anti-inflammatory drugs, your NSAIDs, non-steroidal anti-inflammatories. Your naproxen, your ibuprofen, aspirin. We are most familiar with these medications because a lot of us, whether we played sports or have fallen, maybe have used these medications in the past to help with swelling and pain. They also can be used as antipyretics or to treat fever. You might commonly see them switching on and off with Tylenol and NSAIDs to treat fever in to treat fever in children or adults. So, generally they inhibit the synthesis of prostaglandins, which are substances that are responsible for producing inflammation and pain. So, side effects of these most commonly is gastric irritation. They're very rough on the stomach, as well as thinning of the blood. So we never want to use them in someone who is on a blood thinner, such as warfarin, or maybe another one you've heard of is Plavix. We also want to try to avoid them in someone who has a history of ulcers, because it is probably going to lead them down the same road. There is an NSAID that is selective and kind of avoids those problems, and it's called Celebrex. So it doesn't pose the same bleeding risk as the non-selective ones. And you'll see that used a lot in patients who absolutely do need an NSAID, but maybe we can't expose them to that bleeding risk. So we always want to use caution in patients who have cardiovascular disorders, kidney disorders, because a lower kidney function means the medication might not get processed as well. Liver dysfunction, again, history of GI ulcers or inflammatory bowel disease. Gastroesophageal reflux disease, because that's kind of along the same lines as having stomach problems. And anybody with a sensitivity to NSAIDs, or in the case of Celebrex, a sulfa allergy. Interactions, again, alcohol increases the risk of deep GI bleeding. Anticoagulants can increase the risk of bleeding overall. Antihypertensives, it can actually lead to an increase in blood pressure, so we kind of try to avoid that combination. And it moves on to osteoporosis therapy, which is the next sort of section of this book. So, sorry, I was a little confused as to how we jumped from NSAIDs to osteoporosis therapy. Osteoporosis therapy has several avenues that you can take. I'm going to have you guys read over each of those. It's just options. The most common one being bisphosphonates, which actually helps slow down the bone turnover or inhibit what they call bone resorption. And basically osteoporosis is an imbalance. So bone is normally turned over as quickly as it's built back up. And when we're in that balance, we're fine. Osteoporosis means bone loss is happening more than bone buildup. So basically that leads to weak or porous bones and can increase a patient's risk of fracture, especially in the hip or the spine. If you've ever seen a little hunched over old woman, it's because she has osteoporosis in her spine, and her vertebrae are starting to become so porous they just can't support the weight of the body, and they actually start crumbling apart, whether it's in one vertebrae or two, and that's what leads to that sort of falling over. So GI side effects of those bisphosphonates can include GI distress. Again, they are rough on the stomach. We recommend the patients stay upright for a number of minutes after they've taken the medication. And that's pretty much the only one. It can also, there was some studies out saying that taking them for too long also wasn't good, but generally we kind of match, we let the physician decide that, how long he wants the patient to be on the medication for. And that is the last part of that chapter. So, again, I hope you guys saw the announcement. Week 5 has been extended out until the 24th of December at 11 p.m. If you've already completed it, there will be some bonus points in your future, or if you complete it before 11 p.m. tonight. If you have any questions, contact me. Week 6 is 2 weeks long, so it's not done until the 3rd of January, and I'll be posting another announcement and some more lectures then. Hope you guys have a great holiday, whichever one you're celebrating, and I'll talk to you soon.